talk to you about our community outreach program. So from our windshield survey, we were able to gather for our location in Cudahy the needs of Cudahy. We found that 65% of students were enrolled in free or reduced price lunch. There was a 38% rate of obesity, as well as 11% of the population having diabetes, and heart disease was the leading cause of death. So these are all very concerning statistics for the health of this area. We also, in our initial meeting with Acelero Learning, when speaking with staff, asked what their needs were, and they requested information on nutritional activities, dental hygiene, and a list of medications that they would like education for their staff. So a little more about Acelero Learning. This is a Head Start daycare program, which serves children from 8 months to 6 years old. And for a Head Start, this is a fully funded state childcare program. It's offered to low-income families, and they'll be within certain zip codes that demonstrate a need. There's a limited number of spaces, and it's an option to make so childcare is affordable for parents. The parents will not have to pay for out-of-pocket for childcare, but they may have limited resources at home, and there may be other needs that they have. So the implementation of what we did 3 separate visits to Acelero. 2 were educational sessions targeted at the children with hands-on learning activities, and our 3rd visit was to provide medication education and training for the staff. So for our hands-on learning, we did 2 focused hands-on learning activities, which hands-on learning is a way for the children to interact so that they're involved in what is being taught to them versus just like lecturing. So we did activities where they were able to participate in different ways. So the first was a nutritional activity, and this was geared towards 4-year-olds, where we had a My Plate and we were sorting food into the food group. And so we discussed nutrition with how food gives us energy, and we discussed how all our plate should always be balanced. When you look at, we'll get to a photo of it later, but when you look at My Plate, we discussed how each of these 4 food groups should be present on your plate at every meal, and how important it is to have a balanced diet and not just eat what we like. Children at this age tend to be very picky, so trying to encourage trying fruits and vegetables that they may not have tried before, or eating more than just macaroni and cheese and chicken nuggets. It's great to have carbs and protein, but encouraging a balanced diet and having them participate by putting it into each category. And we even ask them questions like, what's your favorite fruit? What's your favorite vegetable? Do you ever eat chicken? And they were able to interact with us. And we also did a coloring activity where they had their own My Plate and they got to color and ask questions. And our second intervention or hands-on learning was a dental health. So we practiced brushing your teeth with dry erase, and we had a sheet that was teeth and a dry erase marker. And they each were able to hold a toothbrush and brush. This was geared at 2-year-olds. They were between 1 and 2 in the room. And it's great for them to learn the motion. That's what this was really focused on, the motion of moving your hand up and down. Children should be brushing their teeth, but often for infants and toddlers, it's the parents that brush for them, but encouraging toddlers to want to participate themselves. And sometimes children refuse, they may only have, an infant might only have 1 tooth and they really don't want that toothbrush because they don't like anything in their mouth. So the purpose of that activity was to encourage them to see, we brush our teeth so that they're clean. And we also discussed germs and how you need to brush away the germs. And that was easy to see with brushing away the dry erase. You could see that it was gone off of the laminated sheet. And our last day was an educational session with staff. So we were able to attend 2 staff meetings, and we led a 30-minute presentation on the medications that they requested and health concerns that they requested. So we discussed albuterol, Benadryl, epinephrine, or an EpiPen for allergies. And then for health concerns, we discussed eczema, high lead exposure, and sickle cell disease. So the goals of these interventions were to fulfill the need of what the daycare was requested to us. So we were able to intersect with the teaching that they provide as well. For the month of March, that's when we did our nutritional activity. That also was their month of nutrition. So they all month had been working on different My Plate activities with sorting foods, and the kids did a great job. So we were able to line up our interaction with what they've already been learning during their circle time at daycare, as well as the dental hygiene. Actually, that was in April, which also lined up with in the month of April that this center does jobs or occupations. That's what the theme of the month is. So they had talked some about the importance of dental hygiene and going to the dentist as well as going to the doctor. So we were able to kind of line those up with what they are already learning at school. In a daycare, the circle time is usually limited, or which is their version of a lecture. It's usually about 15 minutes, and it's often with lots of colors and pictures, and you try to get the children to participate the best they can, depending on their age. And the goal of our medication was to answer any questions of the staff and explain what they may not have fully understood. They do administer albuterol, and they do have severe allergies, so they needed information on how to properly administer Benadryl as well as an EpiPen. So we were able to provide that. And they do have children with sickle cell anemia at their center. So they're being able to educate what is sickle cell anemia, what are concerns we have with children for this, and what interventions do we offer to them. I think it was very beneficial for the staff. They were able to ask questions and participate well. So our outcomes of this, for the nutritional activity, the students did a great job sorting into each category. We did have to redirect some, they might put, hot dog in the grain by accident because it has a bun. Or they might just not know. They've never seen this photo of broccoli, so they don't know where broccoli goes. So we did help guide them, but they did a great job participating and also answering questions. The dental hygiene was very successful. Students were able to brush their teeth, or the teeth on the sheet, and they were really excited about it. We had one child that kept saying more germs because he wanted to brush more away. And we also gave each of the children their own personal toothbrush that was individually wrapped for them to take home, so that they had a toothbrush at home, because some of these children may not brush their teeth at home or may not have a toothbrush. Oftentimes, you don't see a dentist until you're 2 years of age or older. Most dentists in the area will not see a child under the age of 2. But it's still important to brush your teeth even before your first dental visit. And finally, for the medication, staff participated actively, asked questions, and we were able to run through what they were seeking. So then we just have a few photos here. So this was for our nutritional activity. You can see this is how they sorted them. So for the My Plate, there's half your plate should be fruits and vegetables, and the other half should be grain and protein, and there should be dairy served at every meal for a balanced meal. And this was a few photos of them participating. You can see the children coming up and placing the little stickers that we had for them in each category. And then this is our toothbrush activity. So you can see them holding the toothbrush and trying to brush away, especially on the left. That was a great view of the children brushing. And you can see in the photo on the right, Holly's marking it down, where we're putting on the expo marker for them to brush it away. And then we were actually asked to do the nutritional activity at a separate location for them. It went so well that they asked if we would do an additional visit. So we were able to squeeze that in, and we went to an after-school program that Acelero also participates in. And then our final photo, you can see us sitting around the table working with the kiddos, and they had a great time. The toddlers loved that activity. We were actually able to leave the resources with the teachers. So we got feedback when we were there for the staff education meeting that they still use it and they love having it in the classroom. And this is just a photo of the toothbrushes we offered. So we offered them blue or pink, and they have a little animal and a suction cup so that it can suction and stay upright. It's a fun way for the child to be excited because it has a little animal on it. It's colorful, and just a way to encourage them to want to brush their teeth versus having just a plain toothbrush. And it also was a toddler toothbrush bought off Amazon. So the size of it is more appropriate for small hands for toddlers. And then you can see some of the resources that we used. We also did a coloring activity for the brush teeth, and we had a little song we sang for This Is How We Take Care of Our Teeth. And these are our references that you can see.